evaluate the patient. And his wife asked me to speak to the medical oncologist. I'm always there to please. So I got on the line with the medical oncologist. I said, if you got this test 3 months ago, then you should get the same test now. So you can compare apples to apples, have the same quality of test. Remember, a PET scan, PET CT shows shadows and activity of the cancer. Now, sometimes doctors don't want to get the best test for different reasons. I believe that this doctor, after speaking to him, didn't want to get the best test because it might show then that the chemo's not working. So he wants to give more chemo, even not knowing that the cancer is responding or not. And I argued to the patient, I didn't argue, I studied my feelings, and my feelings are, if you're going to get chemotherapy, which is potentially toxic material, it should be working. You should have a documentation that it's working before you go on with 3 more months of chemo. Doesn't that seem to be a normal, logical approach? You want to know the treatment is working. The patient should have a report in their hand. They should have the images. They should be able to go anywhere they want and compare them. And that's what I suggested to this patient and his wife. So hopefully he will get a PET scan. I'm not very hopeful that he will, because unfortunately one party believes that an inconclusive CAT scan is enough. I always believe you should know the facts, know the data before you proceed. If you don't, you're going to get into trouble. So for this man with lung cancer that we treated, where we treated it, the cancer shrank by 80%. Where he's getting the chemo, we have no idea if it's working or not. I've urged him to get a PET CT scan. I've given him a prescription. I've spoken to the radiologist. I spoke to the medical oncologist. I wish him well. I hope he comes back soon with a PET scan so we can know exactly if that other treatment is working or not. If it's not, maybe we'll offer more radiosurgery, which you've already proven has working. And here's another case, part of that VA spinoff. We've heard about the VA and how they're treating some of our veterans in a way that's suboptimal. And we know that's not true in every veterans hospital. We know that some are exemplary, and then there's others. This is a man, 62 years old, married with 2 children, had bladder cancer 2 years ago. He had some chemo before, and then was told he had to have removal of the bladder. Excuse me, we're going to take this call. See what's calling here. Hello, good morning. You're on the radio.
Good morning, doctor. How are you?
Hey, okay. How are you doing today?
Fine, thank you. I want to thank you. I received all your goodies in the mail.
Okay.
I have one question. I have been advised by my urologist to have green light treatment. You familiar with that?
To have what treatment?
Green light.
For what reason?
My prostate is enlarged, and I'm urinating frequently.
Mm-hmm.
And I had this green light treatment done. I'm in New Jersey.
Mm-hmm.
I had it done in Florida about 10 years ago, but the prostate has enlarged, and the frequency is rather annoying and embarrassing, and I don't want it to lead to further things. And I wondered if you believe in it, or...
Well, what I'd like to do, we're on the radio now, we're talking with 50,000 people, so what I'd like is if you call this number later, or better yet, come in and we can talk privately about your situation.
Yes, sir.
That would be the best for you. So just give me a call during the week at this number. And it'd be...
your material, and I will do that.
Okay.
As you suggest.
All right, thank you, and God bless you.
Thank you, sir.
Okay, bye-bye now.
Bye.
So we obviously treat a lot of people and take a lot of calls. Anyway, this gentleman had a bladder cancer, and unfortunately, he was not given options. So for bladder cancer, yes, surgery is one option. He had removal of the bladder. He was having a replacement called a neo bladder, which is a fake bladder made for him. This was 2 years ago. Since that time, he's had tremendous difficulty urinating. He's had 5 surgical procedures to try to fix this neobladder. He's had repeated infections. It's not working. He came in to see me this week. He has not been restaged to see if the cancer is gone or not gone. And then I went through his documents, and in fact he had some lymph nodes in the mediastinum, the center of the chest between the right and left lung, which were enlarging. 2 years ago, and it hasn't been followed since. 2 years ago, the lymph nodes were enlarging. No one's followed them. He got surgery. He was not offered other options, and we know that we can offer treatment most likely to effectively save the bladder, just like women who have breast cancer can have, in many instances, lumpectomy, remove the little lump of cancer and give radiation, and have a higher success rate than with removing the breast. And similarly, for people with bladder cancer, men and women, radiation or radiosurgery is an effective method of treating bladder cancer with similar results to removing the bladder. And you can keep your bladder and keep your quality of life. You can urinate normally rather than tubes and infections and complications. So for this man, I was shocked, honestly, that no one ever spoke to him about treatment options. He saw a surgeon. The surgeon did the removal of the bladder. He's had multiple complications. He's now having trouble getting back to that surgeon. Wow. So the message is, for those of you with bladder cancer, there's more than one option. And there's options that may well save your bladder, hopefully save your life, and hopefully save your quality of life. So bladder cancer, give us a call, 212-CHOICES. We're happy to speak to you and talk about treatment options. And by the way, remember that 100-year-old woman with bladder cancer we treated in 5 treatments is in remission. The bleeding is stopped. She's about 5 months out from treatment, doing great. And in the urinary department, where we are right at this moment, we saw a man, 62 years old, from Egypt. He came to us, married with 2 children. He was diagnosed with cancer in 2012. We have another call, so we're going to take this call. Yes, you're on the radio. This is Dr. Lederman. Good morning.
Hi, good morning.
How are you
Dr.
today?
Lederman, I'm listening to you on the radio.
Oh, good.
Okay. Well, first of all, I'm 84 years old.
Okay.
I'm old by years, but not by spirit.
Well, join the club.
When you speak, I listen to every word and try to analyze, but I have a problem.
Okay.
About a month ago, my dentist did x-rays, cleaning, filling, an examination of soft tissue down in the back of my throat, and he discovered a nodule. And he gave me an explanation on paper, an approximate size, and he told me, see eye, ear, nose, and throat doctor.
Okay.
But I don't know which way to go. Go to you, go there.
Well, I'd suggest you come in so we can sit down, so I can examine you and go over the paperwork and review all the information. That's really the best way. Unfortunately, a phone call is a great way to start, but it's not the best way to get all the information.
I imagine so, but I mean, you're familiar with throat?
What's that?
Throat, it's in my throat somewhere.
We're very familiar with throat and tumors in the throat and cancers in the throat, something we deal with every day.
Okay. Well, listen, I'm a warrior. I'm a survivor of 4 or 5 hip surgeries and 2 knee replacements, but the hip surgeries was pretty bad. But okay.
Just give us a call.
Bravado.
Just call the same number. Just call the same number, 212-CHOICES, and I promise to see you within 1 day if you want. We're super conveniently located, 38th and Broadway. All the subways, buses, trains come. We'll take care of you and give you the options that you deserve.
Okay, honey. Thank you so much.
God bless you.
My name is Marjorie.
Okay. God bless you. I'll hope to see you soon. Okay. Bye now.
Thank you.
Bye-bye. And we take care of lots of people with cancers of the head and neck area. Most of them, hopefully she doesn't have a cancer, but those with cancers, most of them are called squamous cancers, and they're very, very sensitive to treatment. We're talking about the 62-year-old gentleman from Egypt, married with 2 kids. He was diagnosed 2 years ago with prostate cancer, and believe it or not, his doctor forgot to tell him. And the man came in angry that he had to wait 2 years. Fortunately, he has a Gleason 6, PSA 3.7. Our data shows a very high success rate, approximately 95% success rate for him, even though he's had this 2-year wait. We don't advocate the 2-year wait. This man wants to live. He works. He has a family. He has every reason to live and be hopefully cured. At 62, he's most likely going to live another 20, 30 years, and we want those years in good health. So we're going to stop right now. We're going to hear from a couple of new voices, and we'll be back to take your calls and your questions. We're live at the WABC studio today. And Russ is the tech, so give Russ a hand. He's managing this program superbly. Thank you, Russ.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD called 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hey, we're back and talking about some interesting cases, actually some new unbelievable cases. So again, if you have questions, call us at 212 Choices. During the week, if you want that booklet and DVD, we have a separate booklet for brain tumors, prostate cancers, and body cancers, 3 separate booklets. Call us, and we'll send it out at no charge with a DVD. Hello, it's Dr. Lederman on the radio. Good morning. How are you? Can you speak up, please?
Yes, I'm calling concerning actually my sister-in-law, who this very week was diagnosed with endometrial cancer.
I'm sorry to hear that.
And I'm wondering if your radiosurgery procedures would be effective for such a cancer.
We do treat many endometrial cancers. We would need to know the stage and more about her. So you may want to call me back after the show if you know more about the case, or she can call and we can talk about the stages and the treatment for each stage?
I know she's in